Mr. President, this is the issue on COVID-19. Mr. President, with 3 patients a few days ago, increasing to 10 patients today, we are an increase of over 200% in a few days, Mr. President. We don't want to create a panic amongst our people, but we also don't want to fall into the complacency that initially pervaded in countries such as Iran, South Korea, and Italy. And now they have thousands of cases and hundreds of deaths. Yes, last night, Mr. President, and I sent the message to our Viber group, Italy has placed total lockdown on 16 million of its people in the Lombardy provinces and regions, Mr. President, unparalleled in European history. Of course, China has placed a lockdown in larger areas, but for Europe, this is a first. We cannot afford, rather, Mr. President, to have a slow, reactive government response to COVID-19. I'm urging a more proactive approach to our agencies and local governments, and Thankfully, I thank the government for coming out with the emergency order, declaring it an emergency situation all over the Philippines. National emergency for health reasons, Mr. President. I'm also looking at the problem in schools. We only have 2 weeks left, summer to begin and classes to end. We know many countries have already stopped schooling. Italy, northern region, has no more classes. Singapore had stopped classes for a month to make sure that the spread stops and they disinfect all schools. Japan has also in certain areas already stopped their classes, schools, from all levels, Mr. President. Secretary Briones was here earlier. I had asked her after she sang that beautiful song, Madam Secretary, maybe it is important that we look at possibly ending our school for summer break early. So, Mr. President, this will allow our children to stay safe at home and allow our schools to be disinfected. There are only a few days left till summer break. We should ask the DepEd to just order early break, as what's been done to hundreds of millions of school kids all over the world to avoid contamination and spread. Mr. President, on another matter, the DOH should make testing kits available at all hospitals. I received this last night from my wife, who was very concerned what was going on. This was a message from her friend. Mr. President, and I quote, "Hello, my girlfriend works at Net Lima, same building as Deloitte, different company. She's had a dry cough for a week. She went to St. Luke's BGC to get tested. They would not entertain us. DOH apparently only allows them to test people with travel histories or confirmed close contacts with infected. God help us all." Mr. President, as already proven by the patient in Green Hills, which are called localized contamination, he had no history of travel. He had no history of meeting anyone that was sick or contaminated. These are the cases that are happening now of people getting sick, and yet no testing is being done on them. That's why I was infuriated last night when I heard one of the undersecretaries of the DOH saying that it is not necessary to get tested. Do not panic, because if you do not travel, if you do not get close to any particular person, you don't need to be tested. Mr. President, that's BS, if I may be allowed to say. Because these localized transmissions are happening now as we speak. I am worried that we are not, maybe not under-reporting, but because of the lack of testing kits, we're not reporting. Nobody's getting tested. Apparently today's hearing, 2,000 kits alone. The DOH only has 2,000 kits for 107 million Filipinos, Mr. President. What is that, 2,000 kits? I hope declaring a state of a health emergency will allow our government agencies now to buy more testing kits and make them available from Aparin to Holo. So let's not keep them in RITM, Mr. President. RITM, my dear colleagues, has only a 50-bed capacity, 50 bed. 20% of that is already occupied by 10 patients. Mr. President, I am not surprised if that will reach 100 by next week. What will happen to RITM? They should now allow more facilities, both private and public, to be utilized and prepared and ready for such an outbreak, Mr. President. The key here is allowing the DOH to make testing kits available at all hospitals. So anyone with coughs or cold can be tested. I don't think this is excessive, Mr. President. Let us not be complacent. We have seen how this virus completely terrorized other countries. Imagine superpowers, South Korea, Italy, the United States has 19 deaths. That's a first world power. If they cannot control it, what more we? China, which is the second largest economic powerhouse of the world, is paralyzed because of this COVID-19. What more us, Mr. President? The key also here is social distancing. That is the key terminology. Aside from washing of hands, not touching the face, social distancing. And I appeal to the churches, Mr. President, of the different denominations. I know this is controversial. My wife is a devout Catholic, and she told me, be careful when I say this. But I'm making an appeal to the hierarchy of the Catholic Church. There should be some protocols, probably already done in church, hygienic protocols. In church, we are seated beside each other. And remember, this is what happened to South Korea. It was a Christian sect. And they were together in a confined area, hugging and holding hands. And before you know it, there are 7,000 already of these, most of which were members of this religious denomination, Mr. President. So, also, what has happened in Iran? Apparently, the spread was also done in the mosques because they're seated right beside each other. So obviously, Mr. President, this virus does not know any religion. It doesn't care if you're a Buddhist, Christian, or Muslim. What is important here is to practice social distancing, and so maybe the proper protocols, even the Vatican, Mr. President, I'll tell you today, has cancelled, because there's already confirmed cases in the Vatican. The Vatican has cancelled their services. So maybe if we cannot cancel the services, particularly in the season that we have now, which is going towards the Holy Week, and then, Mr. President, maybe they can put alcohol in every station of church, in the entrances. Maybe also that the priest, I do not know how they can give the host now. Because, Mr. President, let's be all honest about this. If the priest had shaken hands with a contaminated patient, and he gives out the host, every person he gives out the host to can be technically contaminated with the virus. So, Mr. President, we need to come up with practical protocols in places of worship of any religion, Mr. President. And I hope they act now, because Lent is coming, and we will have Visita Iglesia, we will have the kissing of the cross. For us faithful, the kissing of the cross in the Catholic faith is very important. What are the protocols for that, Mr. President? Imagine 10,000 people kissing one cross. If there was just one COVID patient there or was asymptomatic, the spread would be tremendous, Mr. President. So, Mr. President, I end my speech by saying we must be more proactive. I think the declaration of the emergency measures is a welcome call. And I think that the DOH, as well as the other agencies, such as the DepEd, should look closely on the idea of coming up with more proactive, and I mean not just proactive, but even drastic measures to prevent the spread of COVID-19. Thank you, Mr. President.
Thank you.